Hi folks, welcome back to Physics Well. I'm MedEd, Dr. Patil here, and today I'm here with an important announcement. Those who had given the UPSC CMS written examination and had cracked it, now the UPSC CMS board has started sending the e-summons to appear for the personality test, or what we call as the interview. So if you have cracked, you might have already received it, and you may be going through a lot of dilemmas. How am I going to prepare? How will I deal with the situation? So I'm here to help you smooth out the process. Okay. So let me first congratulate for being selected to the interview. Let's start on a positive note. Okay. Now, e-summons letters for personality test. If you have not received, but if you have cracked the written examination, you can download it from the UPSC website. The link is here. The second thing I want you to note is that the interview will be held in two sessions, the morning session and the afternoon session. For the morning session, you are supposed to report on your designated date at 9 a.m. And for the afternoon session, the reporting time is 1 p.m. Right? So keep that in mind. Don't be late to your interview. Okay. Now, what are the things that I want to address in this video module? First thing, you may be going through uncertainty about your preparation strategy for interview. So let's see what we can do for that. You may be having confusion about what should be the source of preparation, right? We will deal with that as well. Of course, you need to deal with your last minute anxiety and stress. And many of you, even after cracking UPSC CMS, you may be still having that dilemma of NEET PG versus UPSC CMS. Should I join the central government workforce or should I prepare for the next NEET PG, right? So let us also take a look at that. Of course, many of you may be having the fear of language barrier in the sense, okay, I'm fluent in Hindi, but what if the assessing board is primarily communicating in English? How will I deal with that? Right? Many of you may still have doubts about the bond and service obligations. You may be worrying about your missing or incorrect documents that you might have given to the board, and then medical examination related concerns. So let's address all of them one by one, right? So now the date is out. You know when is your interview scheduled. What do I do next? How do I plan for the interview? So let me give you an overview of what this interview is all about. Interview carries around 100 marks. It might last around 20 to 25 minutes, and the interview panel consists of around 4 to 5 members, out of which one is going to be the administrative officer from the government, basically an IAS officer, and the remaining 3 to 4 are going to be doctors, mostly from clinical branches like medicine, surgery, ops, gyne, ENT, opthal, ortho, or PSM. Okay, what is the focus area of this interview? It's not just about knowledge, because your knowledge is already tested in the written exam. So here they want to test your personality, your clarity of thought, your ability to make critical decisions, and your attitude as a person and as a professional. So that's what we need to groom ourselves to, like, to give the opinion or give the impression that you have a strong persona, you have clarity of thoughts, you're capable of making critical decisions when faced with, and you have the right attitude towards your profession. That's what the interview is all about. Okay, so now I have some important tips for all of you. The first thing, though I said that it is not about testing knowledge, they may still go into medical topics. So I want you to revise the core of medicine, means core of surgery, medicine, ops, gyne, pediatrics. What is the core? You already know, right? What comes as core in medicine? Some part of cardiology, like heart failure, hypertension. In endocrinology, diabetes mellitus, hypothyroidism, hyperthyroidism. In hepatology, CLD. In gastroenterology, IBD, irritable bowel syndrome, peptic ulcer disease. This is what is core of medicine. So do core of medicine, core of surgery, core of ops gyne, core of pediatrics. In pediatrics, what is core? Vaccination schedules, common infections. That's the core, right? Apart from the core, you should be familiar with the management of common emergencies, like the management protocol for the ischemic heart disease or MI, stroke protocol, like when do we do thrombolysis, when do we go for mechanical thrombectomy, when do we just resort to conservative management, from surgery, trauma and burns, then from the obstetrics, the obstetric shock, other obstetric emergencies. I want you to quickly revise with whatever time is available to you about these topics. Apart from these topics, I'm pretty sure that you will be getting questions on the national health programs, because remember, you are going to join the government forces. You're going to become part of the programs which deliver healthcare needs to the society. So at least the major important national health programs concerned with TB, then malaria, then mother and child health, right? Please revise all those national health programs from your PSM. Then you should be updated about the recent policies and bills from the government, like for example, whatever policy changes that were made during COVID, all that you need to be aware about. And you should also be aware about the current health affairs. Like for example, right now in Kerala, we are seeing a lot of patients with the Naegleria fowleri meningoencephalitis cases, the brain eating amoeba. So examiners might ask you questions on that. What is the right source for me to get updated about the current affairs related to health? Traditionally, for all the UPSC boards, not just the CMS, but even for IAS or other UPSC boards, the newspapers like Hindu, Indian Express, they are considered as good sources. So till your interview is done, read the Hindu and Indian Express on daily basis. Okay. Then, apart from all this knowledge and update, ultimately how you carry yourself in the interview matters. So please practice giving mock interviews. Now, who can be the interviewer for you? You can ask one of your senior, one of your faculty member, or one of your consultant to be the interviewer. Give them a little update of what I've covered in the video, right? The primary focus of this interview is to assess your personality, clarity of thought, decision making, and attitude, with little bit of testing of your medical knowledge, not core detailed testing of your medical knowledge. Give that insight to the interviewer, and maybe you can show one or two mock interviews of IS that is available on the YouTube, and your faculty or your senior will get a gist or get an idea how to be the interviewer. He will be able to be the interviewer, and then you be the candidate. Give these mock interviews. Okay. Now, what are they going to ask me in those interviews? So the questions that they're going to ask in the interviews can be categorized in four broad groups: the personal questions, situational questions, knowledge based questions, and attitude based questions. Personal questions will be like your background, motivation, like what's your background, who are you as a person, what makes you join UPSC CMS, right? Those kind of questions. Situation questions are like handling your, they give you a circumstance or a scenario, and then they will ask you to describe how you handle it. Like you got a patient with chest pain and you don't have ECG, how will you handle it? You got a patient with chest pain, ECG is there, it shows ST elevation MI, how will you handle it? Situational, right? It need not always be the medical situations. It could also be public health concerns. Like there is an outbreak of cholera, how are you going to handle it? Those kind of questions. Then knowledge based, of course, these are mostly clinical, relatively straightforward questions, and policy based, all these government health scheme based questions. The last set is attitudes, where they try to test ethics, decision making, and honesty. Means whether you have the basic ethics of the profession, like whatever the ethics our profession calls for. Like for example, they may ask you, would you be okay to accept some gifts from the medical representatives? You know that it is immoral, unethical, and also illegal. So examiner expect you to deny, saying that no sir, it is unethical and not legal, so I wouldn't do that, right? So these are the four kinds of questions. Let us see each category one by one. So let me start first with the personal questions. What are they going to ask you in this personal category of questions? One of the open-ended question you may face is, tell us about yourself. So please prepare to tell the assessor about yourself. Let it not be more than 4 sentences. So try to summarize who you are in 4 sentences. And in that, it's going to be very personal. Means you decide what you want to communicate. For example, if I am asked, tell us about yourself, I'm going to start with my journey because I come from a village. So I would say that I belong to this village. I belong to a farmer's family. And then from there, I have progressed to get an MBBS in this particular college. And after that, I've done this particular PG. And now currently what I'm doing. This is how I'm going to present it. You people need not present the same way. Like it's about storytelling. So tell your story in 3 to 4 sentences. A simplest structure to the story is going to be like, I come from this place, I belong to this kind of family, this is where I've done MBBS from, and this is where I want to go forward. That's it. Second, they may ask you, why did you choose medicine, or why CMS? Right? Whatever is the reason behind you choosing the medicine, tell that. But of course, don't say that I chose the medical branches or I chose to come into MBBS for money. It's not a pleasant answer to give. So keep that aside. And whatever other reason, of course, not everyone came into MBBS for money, or money is not the only reason, because money can be made by other profession as well. So of course you have a reason. So tell that reason honestly, but keep the money part aside. Then if they're asking why choose CMS only, you may have a reason. Tell that reason honestly. Okay. They may ask you about your strengths and weaknesses. So make a list of 3 strengths that you can communicate and 3 weaknesses you can communicate, and also be prepared if asked, how are you going to manage your weaknesses? Then be able to answer that. Fourth kind of question you may get is, what is your long-term career goals? Be honest and communicate what's your long-term career goals. Even if you want to become a specialist, there is no restriction in communicating that to the assessor. You can say that, sir, I'm going to join the UPSC CMS now. 3 years down the line, I would be looking forward to get into a PG training program for obs-gyne or surgery or pediatrics, whatever it is. And after that, I'll come back. So just make sure that you mention that you'll come back and continue to serve the government. Basically, whoever is hiring someone, they're always looking for long-term relationships and not short-term. So don't give the picture that you're running away from the government service as soon as you're getting a PG seat. Okay. Then they may ask you direct questions related to your family, background, hometown. Be able to answer that. Right? It's all fact-based, so there's nothing much to prepare about it. But when they ask you to tell us about yourself, please convey an efficient, convincing, fact-based story of your journey. That's about personal questions. Now, while answering, there are a few points I want you to notice. Be authentic. It builds trust from the assessor, and at the same time, your lies will be caught quite easily by the assessors, because they are all seasoned professionals. They have seen patients lying, they have seen attenders lying, they have seen their colleagues lying, they have seen everyone. So you lie, you get caught. So be authentic, be concise, don't beat around the bush. Just like make sure that the sentence delivers the message, but it's not a stretched sentence. In your communication, show the motivation. Like now when I'm talking, right, I am a bit dramatic because I'm trying to show the motivation. Show that motivation in your communication, but then again, don't be over dramatic or very melodramatic, right? Like no one is expecting you to shed tears in an interview. Okay. And this part is particularly important. Why CMS? If they're asking, right, the examiners want the specific answer. Just don't say that I felt CMS is better than NEET PG. No, that's a very bland statement. You can say that I am here, I got into MBBS because I wanted to serve people, and I feel the private practice or private jobs come with financial restrictions, so they cater only to those who can afford treatment. But when I'm working for government, I'm treating those individuals who cannot afford treatment. So that satisfies my urge to serve the people. This is the story that you're building, but it is very specific and to the point. Beyond that, you can definitely, there is no harm in saying that CMS allows me to deliver the care to people with perks, which I may not be getting elsewhere. That's why I'm interested in CMS. There's nothing wrong in saying that. But always make sure that the first point you state is purpose, is about purpose. Okay. Then if they ask you about your skills and all, you should be able to highlight your skills, especially those skills, emphasize those skills which are valuable in public health. Like don't say that I can organize a music event, I organize it in my college and all. They have no public health relevance. So emphasize those skills which have public health relevance. Clear? So if you feel that I can organize a health camp for detection of diabetes or hypertension. You've done it in the past and you feel you're a good organizer, emphasize that. The truth is, I'm not a good organizer. You ask me to gather 1,000 people and screen them for diabetes. I may not be able to gather 5 people, but I know my juniors, colleagues, seniors, even my students who are capable to mobilize 1,000 people to come and participate in the camp. It's a skill. If you have such skill, put it out, right? Okay, so that's about the personal questions. Now, if they're asking situational questions, what are they going to ask? Mostly real life scenarios. They give you scenarios and then ask you to deal with the scenario. One of the scenario could be the ethical dilemma resolution. For example, they may say that there is an elderly man who is battling a terminal illness and he wants to end his life, and he comes to you saying that please give something to finish my life, right? How will you deal with this situation? So in that case, you should communicate that the euthanasia is not legal in our country, so I cannot practice it. So I have to convey this gentleman that it is not legal, it is not acceptable, so he has to accept the life despite knowing that there is suffering. But I will definitely channelize, or I will direct him to go to the right person who can help deal with his current suffering. Because if he wants to say that I want to die, there's a reason, right? Either he has a cancer which is extremely painful, he's not able to deal with it, or there are financial issues. You can appropriately refer the person who can be helping him, right? If it is about financial issues, then you can say that, sir, I would refer him to a NGO or a social service provider who can probably help this person. If it is pain, maybe I will refer him to a pain medicine specialist or an anesthetist or a oncologist appropriately. But I will also counsel him saying that this euthanasia is not legal in the country, right? So this is how I would handle this ethical dilemma. Then there may be questions related to rural healthcare management where facilities are limited. So what's the next best alternative path you can take, right? Okay. Then whatever, like, if they may ask you, let us say this is the current situation of the country and you want to reform it, you want the health of the people to get better, so what reforms at the level of health ministry you would like to suggest? So mentally be prepared with few suggestions. Similarly, they may ask you questions related to handling shortage of medications. So you should, the usual answer to such circumstances is like, if they ask you, you have shortage of, let us say, azithromycin in a PHC, how will you handle the situation? How can anybody handle the situation when there is no azithromycin available? Well, you can say that, sir, I would like to be aware of locally prevalent infections, and I would probably talk to the microbiologist having their labs in the nearby or in that locality. I will try to understand the resistance patterns and common infections, and then in that case, I will probably be able to shortlist other best alternatives to azithromycin for that locality. So that, like, let us say ciprofloxacin is available in the government stock, azithromycin is not there, and common infections that are prevalent in that locality are sensitive to azithromycin and ciprofloxacin. So then azithromycin slack doesn't bother me, so I will use ciprofloxacin, right? It's not a random decision to switch azithromycin to ciprofloxacin. It's based on the epidemiological data. So you can say that I would try to gather the epidemiological data from whatever resources available to me. And based on that, I will make my decision. How do I handle that shortage of azithromycin? Let us say there is a question asking you shortage of some chemotherapy drugs. How do you handle? Then you can say that I would probably refer the patient to appropriate tertiary or quaternary care center where the chemotherapeutic agents may be available. Or if there is a way to channelize, or there is a channel to move the chemotherapeutic agents from higher center to this, I will probably prefer to do that, right? Then there may be questions related to staff conflict resolution, like there is a conflict between two colleagues, right, both doctors, or there is a conflict between a staff nurse and a doctor, there's a conflict between a OT staff and a doctor. How do you resolve, right? So in that case, again, such situations, the best way to answer the questions is being aware of the moral, legal, and ethical responsibilities of each roles. Like, okay, I'm the surgeon, what's my moral, legal, and ethical responsibility? And the other person who is in conflict with me, be my colleague or my staff nurse or OT staff, whoever it is, what is his role, legal, moral, and ethical role, and what is my legal, moral, and ethical role. So once I'm able to define that, then I know who has transgressed or who has broken his role, right? So then appropriately that person should be held responsible for the conflict, and the other person should be relieved. Like for example, there is a senior surgeon who is directly responsible, who is a consultant for the patient, and there is an assistant who is also a doctor. Now here assistant is the subordinate and the senior consultant is legally, morally, and ethically responsible for the case because case is admitted under his care. Now if there is a conflict which is about medical decision making, then evidence comes into picture. Like for example, in this case, the surgeon says appendectomy is indicated and the assistant says it is not indicated. In such cases, the resolution is quite simple because all you have to do is, what are the guidelines for appendectomy? If the guidelines say that yes, it is indicated, it is indicated. The senior surgeon may be wrong. If guidelines say it is not indicated, not indicated. Junior surgeon may also be wrong. But if it is more about who enters the OT first, right, who leaves the OT last, if such conflicts are quite common, in those cases you might have to use a little bit of brain and then come out with more logical answer. How would you like to resolve the conflict, right? So in that case, again, you can take the legal, moral, and ethical roles into picture, right? And then see, you already know what is the role of a doctor, what is the role of staff. So based on who did not do their role properly, you can say that he is at fault and he should be, like, appropriate action should be taken on this particular person, right? So how to tackle this situational questions? Describe how you resolved an ethical dilemma, highlighting integrity and decision making. Explain strategies to address rural health challenges, showing your problem solving skills. Discuss potential healthcare reforms to demonstrate leadership and vision. So whenever you're suggesting reform, it should not be random. It should give the message that you're capable of becoming a leader for the healthcare space. Then outline steps to manage medicine shortage, emphasizing resourcefulness and crisis management. I give you a few examples, right? And then detail how would you resolve staff conflict, showcasing interpersonal skills and diplomacy. Okay. The next category of questions is knowledge based. What do they usually ask on the knowledge based questions? Usually medical, core medical, surgical, or obgyn problems, national health schemes, right? Policies. And because COVID-19 was a big public health challenge and government efficiently handled it, there may be questions related to that. I've already told you, you need to be prepared with these topics, right? There's a short list of topics on your screen. You can take a screenshot or you can ask the PW MedEd team to share this PPT, and you should be able to prepare all these topics. So most commonly on this knowledge based, they will ask you disease outbreak management. Especially, I want you to prepare about the cholera, COVID-19, H1N1, then any outbreaks of meningitis, meningoencephalitis, then also about the management of the tuberculosis, HIV, which are literally endemic in our country, right? From the pediatrics, yes, also about vaccination. Emergency, it's all about basic emergency management, in the sense the CPR, ACLS, BLS, fluid management, IV fluids, IV cannulas, and then triaging. Yes, PSM is always relevant when it comes to central government exams. Please at least read about basic terms like the incidence, prevalence, right? Mortality, relative risk, attributable risk, all these terms. Okay. So after the knowledge, next set of questions is about attitude. So in this, they're primarily testing whether you appear confident or not, whether you show honesty and transparency during interview, whether you have the empathy and compassion towards your profession, your subordinates, your patients, and then in your communication, whether you have the clarity and whether the tone is appropriate or not, right? So whenever you are facing your, like, they may not even ask you questions on attitude, but they're judging, right? So that's why stay calm. Even I know it's a pressure situation, but stay calm. Answer with clarity, don't rush fast, because the more fast you talk, you usually end up blabbering, bluffing, or committing mistakes. Okay. Then, if you don't know something, clearly admit, sir, I don't know, but I will definitely try to learn about it. When there is any question asked about the management of situations, whether it is public health situation like the outbreaks of diseases or an individual case-based situation, your communication should keep the patient at the center. Means you are there with the patient's interest. You're trying to defend the patient interest, not your interest, not government's interest, right? And also please practice answering the questions more and more in the mock interviews, so that you come out as a person with clear communication. Don't use too much jargon, don't use vague words, like be very precise and clear. And again, I want your body language to be respectful, right? Like casually आप नहीं बैठ सकते, you can't sit casually in an interview, right? Be very sincere, sit upright, straight, hands by side, and then eye contact and answer what they are asking. So few tips, how do you introduce yourself? Start with the basics, your name, hometown, your current details, right? Then you can talk about your academic highlights. Don't be too detailed, like okay, I have done MBBS from this, and if there are some exceptional achievements like during MBBS you got a university medal in pharmacology or something, you can communicate. Then I want you to talk about the career motivation, hobbies, interests. Until and unless you feel the panel is at ease, you don't have to dig too deep into your hobbies and interests, because it might give the picture who you are, but then most of us get carried away. Then we'll start talking about cricket, India Pakistan match. Yes, I'm passionate about cricket. Just tell I'm passionate about cricket. I play cricket. I'm a bowler. More than enough. You don't say that I'm right arm, medium fast bowler, right? I prefer to bowl from this end. I have taken these wickets. No. Keep it concise and simple. I would say that hobbies or interests should not occupy for more than 1 to 2 sentences. 1 to 2 sentences on basics, 1 to 2 sentences on your academic highlights, 1 to 2 sentences on your career motivation, and 1 or 2 sentences on your hobbies or interest. I've already told you body language is very important. Maintain the eye contact, sit upright, right? Please maintain a decorum of the situation. Now, how do I handle the anxiety during this interview? Please revise your application form, revise the key core medicine topics, schemes, and also the more sorted you're on the knowledge part, you will appear more calm. Right? More confused I am, I will appear more anxious. Right? Then have this mental picture. Visualize yourself entering into the interview hall confidently. The more you visualize, more confident you become. Visualize yourself answering calmly. The more you visualize yourself answering calmly, more less anxious you will become. Okay. Then also do practice deep breathing exercises which help you to relax. Till the interview is done, always do a positive self-talk. Don't say that I don't know what is going to happen. No, from now onwards, I'm prepared. I'm gonna crack it. Right? On that day, eat light, because heavy meals can make you a little drowsy, sleepy, and you do not want to give that impression that you're here up drunk. Right? So eat light, stay hydrated, and also avoid excessive caffeine on that day. The reason is excessive caffeine can make you anxious, give you a little bit of tremor. So I don't want you to go through that. Dress formally, no casual dressing. Keep your documents ready, and the formal dress also, let it be neat, tidy. I'm not saying expensive, but neat and tidy. And then on the day, disconnect from the social media and news, because that's just a roadblock rather than going to add anything positive to you, right? Now coming to this NEET PG and UPSC CMS dilemma. Many of you may be still having this dilemma, right? Like, okay, I cracked the CMS, interview call has come, but then maybe I can also appear for the next NEET PG and get into PG. So that confusion, let me solve it one last time. So CMS offers you flexibility even if you get a NEET PG seat. What is the flexibility? If you get a NEET PG seat and you get selected, you have option of taking 3 years of leave to complete your PG. Means you don't have to surrender or resign your job. That resignation choice is always there. You resign, quit, join your PG, done. No formalities, no bond, nothing. Just like any other job, let us say you have joined a private hospital till your NEET PG and you crack the NEET PG, you get a seat, you resign and join the NEET PG, right? Same you can do with UPSC CMS also. Don't tell this to the assessor saying that you have this plan, but that flexibility is there. Or if you want to retain your government job, then whatever 3 years of PG, it will be considered as academic leave or study leave. During this period, you will continue to draw the salary and not the stipend from the institute where you're doing your PG. Only thing is, if you're doing PG when you are in the government service, the CMS service, in that case, you need to sign an affidavit with the CGHS stating that you will continue to serve the government for 3 years after your PG. And this benefit, like this benefit of taking the academic leave, is there only for the CMS. It's not there for other cadre, right? And not just MD or MS, you can also pursue DNB or fellowship programs as academic leave through your CMS. But you can't pursue the senior residentship after your PG, because senior residentship is a job. It's not a study leave. It's considered a job. So you have to quit your CMS job to do the senior residentship if you want to do. But if you want to get back to the government job, no issues, right? But after your, let us say you've done your MD or DNB or MS, and you want to pursue further for super specialty, you can again avail the study leave. Just be aware that after your PG, you are supposed to serve the government for 3 years. And after 3 years, you have no obligations. You can put your papers and then walk out of the government service to join the private if you want to. As far as I know, people who get into the government service, they absolutely love the professional satisfaction they are going to get, because they are well taken care of, they are well paid, they are given decent facilities. And then when every day they go to the clinic or the hospital, they don't have to think about the paying capability of the patient to treat them, right? That's professionally a very rewarding experience. So as far as I know, a lot of doctors who join the government services do not like to quit, they continue, but the choice is yours. If you feel that you can have a better life in private practice, you can quit after completing your formalities, right? Okay, now let's move forward. Now regarding the documentation, please make a checklist and make sure you're carrying your originals and photocopies, because the verification happens before the interview. Don't worry if you are having, like, you might have made a statement and to support that you may not have the document right now. The UPSC allows you 6 months of window period to submit the document. So right now, if it is missing, as long as you know that it's legal document, you don't have to stress too much. You have 6 months time to submit it. Okay, and organize everything early right now itself, maybe in next 1 or 2 days, so that you don't have the last minute rush. Now regarding the language fear, for most of the panelists, they will be able to communicate in English as well as Hindi. So speak in whichever language you are comfortable. Good if English, but Hindi is not a drawback at all. And if it is English, it's fairly acceptable. But when you're using the medical terms, please do not use a Hindi word for it, because your assessors may not know those words. Then again, there will be a lot of back and forth. They will ask you a question, what is the meaning of this? And then you have to again dig your mind and give a English word for it. So don't mess that up. For all medical terms, stick to English. But rest of the things you can, like rest of the sentence can be constructed in Hindi as well. The panel actually values clarity, confidence, and reasoning, and not your accent. So don't bother about like, okay, I'm West Bengali, I have a Bengali accent. I am from Kerala, I have a Malayali accent. Doesn't matter. All they want is clarity in your thoughts, not in your accent. Confidence in your thoughts and action, not in your accent. Reasoning in your thoughts, not in your accent. Be consistent. Do not switch your versions or answers midway. Like you say that, sir, that is illegal, immoral, and then midway you change. No, sir, that should be considered acceptable. Stick to your viewpoint, right? And then focus on the content over language, because even the panelist may not be fluent in the language. Not everyone is a social media influencer. Not everyone is an orator, right? The greatest clinicians, greatest surgeons need not be the best orators. Even the assessors may not be good orators. They're not expecting you to be good orator, right? So don't bother too much about your language proficiency and all, but the content of what you're talking matters a lot. So concentrate on that. So with this, I would say all the best for your interview. You have cleared one of the toughest written examination. So now it's just time to crack a small part of this exam so that finally your dream is achieved, right? Believe in your preparation, be confident, and have the clarity. Every question that assessor poses you is an opportunity to demonstrate your thought process, your leadership skills, right? Stay calm and composed. Panel is looking for potential, not for perfection. Remember why you chose the CMS. You wanted to make a difference to the public health, not just an individual who could afford your fees, right? So that's why you're getting into the government job. Keep that in mind and let that reflect in your answers. So with that, I'm wishing you all the best. Let me know after your interview how it went. Our PW MedEd team is always here to help you. All the best, guys. See you soon. Bye bye.